On the third phase, which is the motion phase, the glenohumeral joint starts on the right side at a horizontal abduction and a flexion. The ending position on the right side is flexion, which makes the movement of flexion. The tension on the right side is concentric. The muscles used are the anterior deltoid and the pectoralis major. On the left side of the glenohumeral joint, the starting position is a flexion and adduction. The ending position on the left side is extension, and the movement is then extension. The left side has an eccentric tension, and the muscles used are the latissimus dorsi, the teres major, and the posterior deltoid. For the scapulothoracic joint on the right side, it does a retraction, an adduction, and an upward rotation as well as an elevation. The ending position is protraction, abduction, and depression. The movements then are protraction, abduction, and depression. On the right side, it also has a concentric tension, and the muscles used are the pectoralis minor, serratus anterior, and the lower trapezius. For the left side of the scapulothoracic joint, the starting position is a protraction and abduction. The ending is a slight elevation, a slight retraction, and a slight adduction. The movement then on the left side is elevation, retraction, and adduction. The tension is eccentric. The muscles used on the left side are the upper trapezius, the middle trapezius, the rhomboids, and the levator scapulae. For the elbow, the right side begins at a flexion, and it ends at a 90 degrees flexion. The movement then is an extension. The tension is concentric. The right side uses the muscles of the triceps brachii and the anconeus. The elbow on the left side starts in a slight flexion and ends in a flexion. The movement then is flexion. The tension is concentric, and the left side uses the biceps brachii, the brachioradialis, and the brachialis. The radial ulnar on the right side begins pronated and ends slightly less pronated. The movement then is supination, and the tension is concentric. The muscles used are the supinator, the biceps brachii, and the brachioradialis. For the left side of the radial ulnar joint, it begins supinated and ends with a slight pronation. The movement then is pronation with a concentric tension. The muscles used are the pronator teres, the pronator quadratus, and the brachioradialis. The starting position for the wrist on the right side is an extension, and it ends in a neutral position. The movement is a flexion, and the tension is concentric. The muscles used are the flexor carpi radialis and the flexor carpi ulnaris, as well as the palmaris longus. The wrist on the left side begins in a slight extension, ends in neutral, and has a flexion movement. The tension is concentric and uses the flexor carpi radialis, the flexi carpi ulnaris, and the palmaris longus. For the fingers on the right side, they begin in a flexion and end in an extension. The movement is then extension and is a concentric movement. The muscles used are the extensor digitorum, extensor indictus,